talk about that today, but a subject just as interesting and important. Anyway, hi, I'm Gretchen Schultz. I volunteer here at the Emeritus College and work with Al Padua, who's back with us today, scheduling speakers for the lunch colloquium. And we are delighted to have Dabney with us today. Before I launch into some accolades, I'll just mention our next program, which is 2 weeks hence. We're back on a regular schedule after shifting things on account of Irma's visit. Our next program, 2 weeks hence, though once again it's going to be a Tuesday program, not a Monday program. We've got these for you to pick up on your way out. If you don't have one, it's the whole of the fall schedule. Everything else after next time is on our usual Monday time. But next time, October 10th, Tuesday, we have Sam Dixon coming, and Sam, as many of you will know, is executive and artistic director at Spivey Hall. He was scheduled to talk to us late spring, early summer, and had to postpone. So we've got him coming Tuesday, October 10th, so please come back for that program. Now, yes, a little bit of information about Dad. Advantage of her presence. She is director of the Center for Humanitarian Emergencies in the Rollins School, director of the Emory Institute of Human Rights, and interim director, why did you accept this? Interim director for the Emory Institute of Developing Nations. And yes, so busy teaching, researching, training other public health workers, and not just here at Emory, and not just in the States, but around the world, has visited this, and this is probably out of date, right? 171 countries since 2010, doing her teaching and training, and is just back as of what, yesterday, day before?
Friday morning.
Friday morning from Brazil. Scared the hell out of us, we will tell you, because if you write Dabney a note, if you wrote in the course of last week to say, hi, how you doing, you all ready to go, you got a message right back that said, I'm out of the country and won't be back for days and days and days. Greg went nuts. But it turns out she checks her email, so she was able to reassure us. Anyhow, she actually is a product of the Rollins School of Public Health, got her master's here in 1998, got a PhD in law from the University of Aberdeen before coming back to Emory in 2011. And the rest is really history, including a wonderful award that she was given by the American Public Health Association just in August. And this is for the person in public health who is doing the most for public health on the international scene. Someone who's considered the top emerging scholar in the field. Carlos Del Rio, who many of you will know, nominated her for that with some wonderful praise. And I think we'll see today why she's deserving of exactly that. I do want to allow her as much time as possible, so I won't go on. I will just turn this over to Dabney, who has right through 1 o'clock to do whatever you would like to do, including whatever is involved with these mysterious numbers. Thank you.
Thank you so much. Well, before we get started, I just want to make sure that everybody did get a number when they came in. Okay, so everybody has one. And if anybody else comes in, we'll make sure, here, speak of the devil. Okay, well, if anybody else comes in, we'll make sure they have one.
Come on in. Oh, that's fine.
And for the folks that are watching online, it's no problem not to have a number. We'll still be able to engage with you, and you'll be able to live vicariously through the folks in the room. So I'm really, really pleased to be here. Thank you so much to the Emeritus College for the invitation and for having me. And I'm actually delighted to see a couple of familiar faces in the room, the Huberts, of course, and Lee, who actually took my class. She reminded me when I was pregnant about 5 years ago. My son's 4.5 now. And also Donna Brogan, who I worked with many moons ago. So the Emory community is a wonderful and small place, and it's so wonderful to have all of you continue to be engaged at Emory. So I'm really, really happy to be here. So the fraught issues and complex challenges related to sexual and reproductive health and rights are not ones that can easily be discussed over the course of an hour. So what I hope to do today is to introduce you to a woman whose story exemplifies many of the challenges that women, both in the US and abroad, face over the course of their lives. Her name is Eve. Eve was raped by a close family friend, her godfather, when she was 19 years old. The rape was her first sexual experience. In an in-depth interview, Eve described incessant verbal harassment from her godfather, her elder brother's best friend, in the months before the rape. He constantly called and texted her, interrogating her about platonic relationships with other men in town and convincing her to spend time alone with him. The fact that he was married with children did not prevent him from engaging in this inappropriate behavior with his goddaughter. Eve described eventually meeting him, not knowing that this encounter would result in her forcible rape. The revelation of Eve's rape during the interview was spontaneous and unexpected. Suffice it to say that by definition, rape is a violent act, regardless of the degree of sexual or physical violence experienced by the survivor. 1 month after she was raped, Eve noticed that her period was late. Terrified, she bought a pregnancy test from a local pharmacy. The test was positive, to her dismay. So she traveled alone to the nearest health center to obtain a blood test to confirm the pregnancy. Again, the test was positive. She shared the results with her rapist, her godfather. Because he did not want to lose his wife and children, his immediate response was that Eve must get an abortion, a highly stigmatized and legally limited procedure. Eve did not know anything about abortions, where to get one, how it was done, what it felt like. She asked her neighbors to explain it to her. They said, "It is also a risk to get an abortion because I asked what having an abortion was like, and my people told me it was worse than having a baby and experiencing childbirth. I told him this, and he told me, regardless, you must get the abortion. You are not the first woman to have ever had one." Though she did not want to get the abortion, her godfather continued to pressure her to get the procedure. He called and texted her every single day, telling her to do it as fast as you can. He forbade her from telling anyone about the pregnancy, and Eve didn't feel as if she could confide in anyone about the situation. She worried about people judging her for getting pregnant outside of a committed relationship, even though she was raped. Eve described this difficult time. "When he started to pressure me to get the abortion, I felt alone. I didn't have enough trust in anyone to tell them what had happened. Because if I'd had enough trust in someone, I know they would not have let me do it. If I'd been given advice, they would have said, 'No, don't do it.' But I didn't have anyone, and I felt so depressed. What made it worse? I couldn't sleep. I couldn't sleep because I was thinking of everything he had told me. At night, I would remember how it all started. And I don't know what he did to find that money, but he gave me the money to get the abortion." Unfortunately, Eve's experience is an egregious example of some of the negative health consequences of unsafe abortion. Her godfather gave her $100 and arranged for her to receive the abortion from an older woman that practices natural medicine in a nearby city. When Eve arrived at the woman's home, she was instructed to remove her pants and underwear and lie on a bed. Eve did not receive any medication before a device like a Papinicoline and then another device like an iron rod were inserted into her vagina. After describing the devices in the interview, Eve made a jerking motion back and forth with her arm to imitate the movement used to perform the abortion. After the procedure, Eve received an unknown injection and was told that she would pass a few clots over the next few days. That night, however, she became feverish, felt disoriented, and began to pass dark, fetid clots of blood. She described the pain she experienced. I felt so much pain when they took her out of me. I felt pain when the blood was leaving my body and when I had the fever. I felt a terrible pain that only I suffered. I'm a different person now because of those pains. When she returned home, Eve was too afraid to tell her family about the rape or the abortion because she was uncertain of their reaction. She was even more terrified of the potential legal repercussions that she could face for violating the legal limits on abortion. Within a few days of the abortion, Eve's brother heard rumors of his sister's situation from neighbors in the street and confronted her about what had happened. At first, Eve denied that she had had an abortion, but her brother questioned her further because it was obvious that she was so sick. Though she was nervous, Eve eventually told her brother everything that had happened, from the harassment to the rape to the unsafe procedure she underwent. Afraid for his sister's life, Eve's brother reached out to a local nurse who discreetly provides post-abortion care to women experiencing complications from unsafe abortions and other obstetric emergencies. The nurse is known to be one of the few healthcare providers who provide post-abortion care, despite the legal repercussions that may befall her because of the total ban. Eve spent almost 2 weeks receiving intensive inpatient care at the only hospital in the region. She had become septic as a result of what she described as a perforated uterus, a common complication from unsafe abortions. Upon her arrival in the hospital, the nurse was afraid that her uterus could not be saved because the infection was so severe. Fortunately, the medical team was able to repair the damage to her uterus. Eve was finally able to return home after she received an ultrasound, underwent multiple procedures to remove infected blood clots, and had uterine surgery. At the request of the gynecologist taking care of her, Eve received the 1-month contraceptive hormonal injection before being discharged. At the time of the interview, Eve said she didn't get the next month's injection because she doesn't have the use for any man. As a result of this experience, she reported feelings of depression, isolation, and recurring dreams about a little girl, which she described in this way. After I was discharged, I always dreamt of a little girl and that she was mine, standing in a doorway, and when I awoke, I couldn't find her. I looked for her in my bed, but she wasn't there. And this has tormented me because it's true. I am the girl that committed this error, but the little girl was not at fault. He pressured me so strongly to get the abortion, so I did. Eve had this recurring dream for about 2 weeks, and she continued to feel depressed even after leaving the hospital. One of the sources of her depression was the isolation she felt because there was no one with whom she could share this experience. Eve expressed that the most helpful thing to her would be to have other people talk about this experience, which is in part the reason why I have chosen to share it with you. But there's another reason too. Eve's story provides a lens through which we can examine some of the most pressing public health and human rights concerns for women. These include violence, unintended pregnancy, and abortion. So each of you has a please raise their hand. Everybody else, please take a look around the room. These people with their hands raised represent the proportion of women globally, 1 in 3, about 30%, who will experience physical, sexual, or psychological violence during their lifetimes. Now, I'd like to ask that each person that has an asterisk or a star next to their number raise their hand. So take a look around. These people represent the proportion of women globally, 1 in 5, about 20%, who will experience an unintended pregnancy during their lifetimes. Thank you. Now, I'd like to ask that each person that has a star and, a number 3, please raise their hand, just a number 3. Again, take a look around. These people represent the proportion of women globally, 1 in 3, who will have an abortion during their lifetimes. Finally, I want to ask that each person that has an asterisk and an exclamation point, please raise their hands. An asterisk and an exclamation point. We've got 2 in the room. These women represent those who have or will experience violence, an unintended pregnancy, and an abortion. About 1 in 10, all 3 of these things. So I wanted to do this exercise to demonstrate to you just how widespread these issues are. If any one of them was an infectious disease, there would be a public outcry against them. Instead, they fester as stigmatized private issues. But that's not the way that I see them. When I tell Eve's story, I believe that I'm telling a story of opportunities. These opportunities are the chance for public health interventions to prevent and protect other women from the types of harm experienced by Eve. Such public health interventions include violence prevention programs aimed at changing harmful gender norms and building healthy relationships. Such programs are targeted not only at women and girls, but also men and boys. I see the opportunity for health education on mental health, comprehensive sexual and reproductive information, and access to a range of contraceptive choices. In the field of public health, we strive for evidence-based decision-making. In Eve's story, we have the chance to use her experience as a form of qualitative data to advocate for policy and legislative change to ensure that women like Eve can safely access abortion and post-abortion care if they choose to do so. Ultimately, public health efforts like these contribute to the fulfillment of sexual and reproductive rights for women everywhere. So what I'd like to do now is now turn to discussion. So I want to ask you all a few questions. What are the health issues that we can identify in Eve's story? And I know there are a number of health folks in the room. So what do you see as some of the health challenges that she faced?
Infection.
Infection, certainly. Yes?
Access to abortion.
Access to abortion. What else?
Depression.
Depression.
Isolation.
Isolation.
Birth control.
Birth control or contraception. Violence. Violence as a public health issue. Absolutely. Anything else? It's a pretty good list, right? She had a lot going on. So what are some of the human rights issues that can be identified in Eve's story?
Why did she have a godfather like that?
Why did she have a godfather like that? Right? Why did she feel so isolated? As you said, she felt isolated, right? This man was harassing her before he raped her. He was harassing her and coercing her. So she didn't have a support system. She couldn't turn to her mother or her friends and say, is this normal? Should this be happening? Can we make this go away? Right?
Sorry, sexual inequality.
Sexual inequality, right? So pregnancy is something that only women experience. And abortion is a medical procedure that only women experience. Yet we have legal limitations. Can anybody think of a medical procedure that only men get that is legally limited?
Vasectomy.
Vasectomy?
Legally limited.
Not limited.
Are there?
That's a lawyer talking.
So only men get vasectomies, that's true. But as far as I know, we don't have state limitations or federal law saying which women or which men or when men can get a vasectomy, right? If we had something that said, you can only get a vasectomy if you're 45 or older, right? Would we think that would be fair? Of course not, maybe not. What other human rights issues do we think of here?
Access to adequate medical care.
Access to adequate medical care, also access to information, right? She wasn't having sex, she wasn't sexually active, so she wasn't using contraception. That makes sense. But even after she was raped, she certainly didn't report her rape to the police, nor did she go to a health facility, right, to receive any kind of care after she was assaulted. And at that time, she missed the opportunity for something like emergency contraception, right, which could have actually prevented the pregnancy. And just also access to information about the abortion, if she missed that window, right? She said she was talking to people in the street. What is this? How does it work? Where do you get it, right? All this information kind of coming from non-medical sources. Right? Yes?
Violence against women.
Violence against women, certainly.
I
So,
would say the whole court system, the whole law enforcement system did not operate in her interest, so she could rely on it. And I can't understand. That's a human right, I think, as well.
absolutely. So she, as I said, she didn't report her rape to the police, and the man that assaulted her was not prosecuted, not brought up on any charges. And I mentioned the legal limitations on abortion, right? So there's two elements of law here, and the work that I do is at the intersection of health and law. So not only did her rapist not get prosecuted or investigated, but also these legal limits on abortion meant that she couldn't access services that she needed. So when we hear about limitations on abortion, in cases of rape and so on, access is still an issue, right? In some places, we can have access to something on paper, but the practical access just isn't there, right? If you are this woman who was in a setting that didn't have social support, that didn't have a lot of resources, she's not thinking about going to the courts, to try and get any kind of remedy. So we'll talk about that in just a second. So, when I think about my work and joining together law and public health, law most often happens after something has happened, right? We think of law and order. There's a crime, and then we want an investigation, and we want a trial, and we want justice. Public health happens on the front end, right? That's on the prevention side. So when I talk about these missed opportunities, that's what I'm really talking about. This is the opportunity for us to make sure that these kinds of things don't happen through public health programs, through policy, legislation, and so on. So, third point, what are the missed opportunities for public health and or legal intervention? Where could public health have intervened? Or where could the law have intervened? Yes?
Sex education.
Sex education. At a very early age, he says, right? This is controversial, isn't it? Right? So in the case of this young woman, 19 years old, she certainly didn't receive education about sex. And more broadly, right? Because, I have a 5-year-old, but I imagine the conversation that I'm going to have with him when he gets a little bit older, right? And that's an uncomfortable conversation. No parent wants to think about their child having sex, especially if they're young. But let's reframe that. Everybody wants their child to be happy and healthy, right? And when you think about your children, and some of you may have children or grandchildren, and you think, I want my child to be in a healthy relationship with a person that they love, that's going to respect them and treat them kindly. Don't we all want that for our children? Right? That's about healthy relationships. Sex is a part of relationships, right? And in healthy relationships, women and boys also, right? I have a son, and I'll give a personal anecdote. And some of you may be guilty of this, but don't feel bad. My mother loves to scoop up my son and just grab him and say, give me a hug, give me a kiss, give me a hug, give me a kiss. And everybody, people love to do this with children. And I said, no, Mom, you can't do that. You can't do that. Because I don't want him to think that he can grab another person and force them to kiss him or hug him, right? So he's 4.5, and I want to say, can I get a kiss? Will you give me a hug, right? Because I want him, when he wants to have affection with someone else, to think about respecting other people's bodies and boundaries. So very young, 4.5, yeah, we can start there. But let's talk about healthy relationships. So that's a great one, missed opportunities. Another missed opportunity? Yeah.
Well, the other thing about sex education is that if the other children, if everybody knew what to do, then they could have told her.
Right.
So if you're against sex education for your own children, to say, but your kids need to be able to tell people what to do if they're in that situation, of what's right and wrong. And I think that's not used very often.
That's right. And I think that, common sense tells us that most of the time, adolescents are getting their information from their peers anyways. Most of them aren't actually going to mom and dad. They're sharing information about themselves, about this kind of thing. So absolutely, having a different social norm in terms of the kinds of information that adolescents or young people may have about what sex is, about how you can prevent getting pregnant or prevent getting sexually transmitted infections. What else? Access to contraceptives. So she actually didn't have access to contraception. Now, she wasn't having sex, right? So, even if she had had education, which she didn't, but she might have said, well, I'm not engaging in sexual behavior. I don't need contraception. After she was raped, you heard that part of the story where the gynecologist gave her a hormonal injection. And she said, I don't have any use for this. Well, I haven't told you yet where Eve is from, but I will tell you that violence against women is very common. Globally, 1 in 3 women. She's already experienced that kind of violence. And it's possible that she may experience violence like that again in her life, right? I'm not saying everybody should be on contraception just out of risk of violence, but recognizing that people need to have information and actual access. Yes?
Yeah, and so part of that would be she would know about the morning after pill, if she knew about contraceptive methods.
Absolutely. So the morning after pill we call emergency contraception, which is a pill that can be taken within a certain window of time after sex. For example, if a condom breaks or an assault happens, as in this case, that would actually prevent a pregnancy. So it is a form of contraception. That's right. Yeah. Yes.
I have a question. In your case study, did Eve have a pediatrician or a physician that she saw?
We don't
Even if it's not regularly.
Mhm.
19, that age group still sometimes sees their pediatrician because they really like the person.
Yeah. We don't know that. This is a real interview, so this is a real person. And we weren't asking questions about experiences with the health sector particularly, like did you have a regular provider? That wasn't kind of the frame that we were coming from. So I can't answer that question directly in her case, but that is a good point.
But, because if she had someone who she trusted,
Mhm.
that she had seen throughout childhood, even though her parents and her community, there weren't resources, she could have gone to that person.
Absolutely. So she didn't have anyone that she trusted, right? She didn't have peers that she felt she could turn to. She didn't feel she could turn to her family. She didn't have people in the health profession that she could turn to, or the police and legal sector kind of for recourse. So a lot of social support missing.
I can't treat a minor without permission.
Okay.
I'm a physician
Okay.
in the USA.
So in the U.S., you can't.
So, that may not have been a source. If she didn't have any money to go to the doctor,
Mhm.
or they were going to put her on the parents' health insurance, they would have found out.
Mhm.
So that's not necessarily a good source.
Yes, absolutely.
Just saying.
And that's true in the case of minor. She was actually 19, but you're very right that there are limitations on some of those kinds of things even in this country. Yes.
Yeah, but a further limitation is if the medical provider opted to refer for things like abortion, because now we have a situation where you can opt out if you don't feel like people should have access to those things. You don't have to talk to them about it.
Mhm. So now we're getting into things like conscientious objection of medical healthcare providers, and not wanting to talk about certain topics, or not because of religious reasons or other reasons, not wanting to talk about certain procedures. So then where is she going to get her information from, right? There are so many, you see the cracks that people can fall through. And she fell through many, many cracks, right? Other missed opportunities here? Yes.
As a pediatrician, I think you can get the same stories with girls that were abused at the age of 2, 4, or 6 and got AIDS and gonorrhea and syphilis and whatever. So I feel sympathy for Eve, but I have more sympathy for my kids who are raped. Absolutely.
So childhood sexual abuse is something that is beginning to be recognized as a part of a public health problem. In the past, we haven't recognized this as much as a public health problem, right? Actually, childhood sexual abuse. But if we think about violence, right? Childhood sexual abuse is a form of violence. And one of the things that we know, CDC has done a study, a number of very extensive studies that I'm sure you're familiar with, which are called the ACEs studies. These are adverse childhood events. So they have a pretty simple instrument. It's about 10 or 12 questions long. And it asks things like, when you were growing up, and this is retrospective, so they ask adults, when you were growing up, did you live in a household where one or both of your parents used alcohol in a way that was more than kind of normal consumption, right? Or did you witness violence in your household? So they have a series of questions. You can Google this and find it, ACEs. And what they found, they did this retrospectively, asking a large cohort of adults, and what they found were lifelong health repercussions, right? So they found, and things that you wouldn't expect. So things like, chronic pain or heart disease, right? Why in the world would heart disease be associated with these childhood events? But actually what we're learning, what the science is telling us, right, is how these stress, we hear about fight or flight, and when people are living in those kind of constant high cortisol zones, then their body actually can cause some of these health effects, these chronic health effects. So this is science that's emerging, and I think that we're beginning to see childhood sexual abuse as a part of the violence problem.
We saw it in the 1960s, so it's nothing new.
Well, we haven't learned anything, have we? We're just getting with the times. We need you to come back and tell us what we're doing wrong.
Well, we tried at Emory a lot in pediatrics.
Mm-hmm. That's great. Other missed opportunities?
Let me ask you, you have mentioned a lot of institutions, but nothing of a religious nature. No church intervention, no religious thing that brought both parties, the rapor and the rapee, into the context of either confessional or other times where there was an opportunity to at least let her talk to somebody about that. And if you do you open that up to reporting? That is to say, if you go to your priest, go to your church, and you talk to him about being raped, does that automatically mean that he can, within the law, report it to the law enforcement or some other enforcement body to do something about this woman's condition and the actor in the case?
Mm-hmm.
And it seems to me that if you approach public health, you're talking about every institution there is that might be of assistance in trying to deal with this social and health problem. And you don't mention the religious aspect of it. Is there a religious aspect to it?
Sure. So I think I'd say a couple things in response to your question. First of all, I love that you want to include all kind of social systems and institutions as a part of public health. We love that because we want, we think everything is public health too. We say, oh, you get up in the morning, you turn on the faucet, clean water, that's public health. You stop at a stoplight, that's public health. I think that other disciplines may have a problem with us claiming their work, but I love that way of thinking. I think there are a couple of things there. in this particular instance, she did not mention the role of religion in her decision making, or talking to any faith, professionals, confessing, or as well as, the aggressor in this case, that he had any religious affiliation. So I can't say specifically to this case. In just a few minutes, I'll tell you exactly where this took place, and I can contextualize it a little bit more. But what I will say is, in the larger study that this was a part of, we did hear a lot about faith and the role that faith plays in women's decisions. And one of the reasons why I think this story is so powerful is because she didn't want this abortion, right? It would be really easy for me to stand up here and kind of, talk from a feminist perspective and say, this is a matter of choice. And that's an argument that we hear a lot, and I happen to agree with that. But I actually think what's more important here is that in this case, she didn't want this abortion. And that's also about choice, right? So it puts the finger right on it, that this is actually about choice, whether or not a woman wants to have an abortion. And I think that in her context, which you'll learn about in a few minutes, that faith does play a very large role, and the views about abortion in this particular community were very complicated and not as straightforward as we might like to think in terms of what women's views are of abortion. So it's not so black and white as we may like to think. Yes?
So we live in a digital world. Information is so trivial to come by. Just log on to Google and put in the right buzzwords. Why didn't she reach out as that former? Was she in some part of Africa where it was not easy to have access to?
Well, a lot of people in Africa have cell phones. I think about 80% of households have cell phones. So there is large access, and she does have access to the internet. No, I can't answer exactly why she didn't look out in that way, try and get that information, except to say that even if she found this information, what would she do, right? Where would she go? There was one health facility in her community. The procedure is legally limited. She legally could not get an abortion. And she didn't have the resources. You heard her talking about the guy scrounging up $100. I think she has the resource, and that was for an illegal abortion, right? She doesn't have the resources to fly to another country or access services elsewhere. So, yeah, it's a combination of things, right? Information is one part, and actually services is another. Yes?
And the internet is full of a lot of false information, so unless you have something to compare it with, just as her friends gave her a lot of false information about abortion.
Mm-hmm.
None of those things they said about her were true. It's definitely more life-threatening to have a child than it is to have an abortion.
Yes. Yeah, and you're absolutely right that, if I haven't done a Google search for abortion, it would be a good exercise to do, but I do know that one of the things that will pop up are these pregnancy crisis centers, which are centers that are actually, definitely coming from a particular perspective in terms of not wanting women to have abortions, wanting to direct them in another direction, but oftentimes with the appearance of coming from a medical perspective. So you're right that there is definitely false information out there for sure. Okay, well, are you dying to know where Eve is from? Who wants to take a guess? Nigeria, one guess. Lee?
United States.
United States, Georgia.
Emory,
Emory? That's close to home. Okay, somebody said Brazil. Well, Eve is from Nicaragua. She's from a place called Ocotal, which is here in the north of the country. And this is a place that was very damaged and very involved in the conflict in the 80s in Central America, in Nicaragua and Honduras, El Salvador. And there is a very high rate of rape in this community. Actually, about 80% of women in the country of Nicaragua will experience some form of violence in their lives. So when I said that it's likely that she may experience this kind of violence again, it's really likely. And this is a community where there were some conservative social norms So as I mentioned, this is a part of a larger study. We were looking at women's experiences of unintended pregnancy, right? What happened when they found out they were pregnant? What did they do? Many women had those children. Some women gave them up for adoption. Some women had abortions. And so we were looking at the range of experiences and the range of reasons for doing so. And this is in part where religion comes in, for sure. There definitely were conservative religious values that played a part in women's thinking around what they should do when they had an unintended pregnancy, and particularly the role of faith, this kind of thinking that, well, it's not the child's fault, right? And so abortion may or may not have been an option for some women because of their beliefs. But also a lack of access to information and comprehensive sexual education that prevent many girls and women from being able to access contraception. So even if a woman felt like she wanted to have an abortion or she wanted to even get contraception, there was really a feeling that this community was so small. And I'll tell you an experience from Georgia, from DeKalb County, about 20 years ago when I was in my MPH program, and we had to go, we had a class on HIV. And so one of our class assignments was to go get an HIV test. And of course we didn't have to report this to the instructors, but it was about what it felt like to go have an HIV test. So myself and 2 or 3 of my co-students, we went down to DeKalb County and we're sitting in the DeKalb County waiting room, and the nurse comes out and says, "Who's here for an HIV test?" Right? Remember how stigmatized HIV was and continues to be, a little bit less now. But imagine that scenario in a small community where we're talking about contraception, where your neighbor or your mom's best friend might be in that same waiting room, and the nurse comes out and says, "Who's here for contraception?" Right? Telling the world, telling the whole community that you're having sex, or that you might be having sex, in a place that has conservative values, where if you are not married, you should not be doing that, right? So that's a big discouraging factor for women going to actually get contraception. So I already talked about the pervasiveness of rape, and we talked about 1 in 10 women experiencing all 3 of these different factors, unintended pregnancy, abortion, and violence, in this case sexual violence. In Nicaragua, abortion is completely banned. It is one of very few countries in the world where under no circumstances, not to save the life of the mother, not in the case of rape, not in the case of fetal abnormality, under no conditions can women have an abortion. So that was simply not an option for her. She would have had to have left the country. But just because abortion is illegal doesn't mean that abortion doesn't happen, right? It just doesn't happen in safe, hygienic places, right? It happens with the natural medicine woman performing an abortion. And these become unsafe situations, unhygienic, where, as in Eve's case, there were very serious repercussions for her health, including infection. And she really almost died from this abortion. So that is where Eve is really from. Now I want to shift us to kind of how this relates to us in our lives. So I want to share with you something called the Global Gag Rule. Some of you heard of this? So this is a policy that it has been in place historically, even before this current administration. There have been various iterations of this particular policy, but basically what it does is it limits the ability of U.S. funded agencies and particular U.S. agencies from providing information about abortion. Not, for sure, not services, but not even information. So previously, under George W. Bush, the version of this policy, which is sometimes called the Mexico City Rule, was that for PEPFAR programs, which are HIV programs, very large HIV funding. We hear about the president's HIV fund that was started under George H.W. Bush. Those programs were exempt. So if a woman was HIV positive and she found out she was pregnant, she could learn about abortion services, okay? Under this current version, so that policy was rolled back under President Obama, and then under President Trump, it has resurfaced, and the new version is actually expanded to all U.S. government agencies. Previously, it was just USAID and the State Department. It now covers all U.S. government agencies. It impacts about $9.5 billion in foreign aid. So these are dollars that we are spending on health services and health information, health programs worldwide. And in none of those programs can women be given any information about abortion or even where they might receive abortion services. There is no mention of abortion whatsoever. And that is including places providing HIV care, okay? So the exception that we had under President Bush no longer stands. It's a blanket rule. But now what I want to do is I want to take Eve, and by the way, I didn't mention that Eve isn't really her name, but I chose the name Eve because, as we know, Eve was the first woman, and so it's kind of an every woman name. So what I want you to do is I want you to imagine that Eve isn't from Nicaragua, that she's from Brazil, where I just got back from. And you all heard that I was in Brazil last week, and Brazil is a place that is known for its culture of violence. There's a lot of community violence, state violence, and interpersonal violence that takes place in Brazil. 1 in 5 women in Brazil lack access to contraception. And on the point of violence, I would mention that pregnancy is actually a risk factor for violence in relationships. Actually being pregnant. So women who are in relationships, sometimes pregnancy can actually trigger violence in a relationship that hasn't previously had violence. Or if it's an abusive relationship, that violence often escalates because the pregnancy or the child is seen as a threat. And as well as having a disabled child is another risk for violence. So you all probably know that about 1.5 years ago, there was Zika. We were all hearing about Zika in the news. And we found the association between Zika virus, which had previously not been seen in the Americas, to a condition called microcephaly, which is basically a very small brain. So what you see here in this image is a child with microcephaly. So it's a very small head. What you're seeing here is the external part of the skull, but it's not just the size of the head, it's actually the size of the brain. So even this smaller skull that you may see, we can't really even tell what's going on inside of there, right? So in Brazil, we found this association between Zika virus and microcephaly. But abortion is also limited in Brazil. And in fact, the point in pregnancy in which you would find out about whether your child had microcephaly is actually very, very late in pregnancy. But there was some thinking around so many women having unplanned pregnancies, that them not being able to access abortion services with the risk of Zika, right? The thought, right, that I could be infected, not knowing that they were infected, but just the thought of that. So Brazil is another place where these very strict limitations on abortion mean that women undergoing particular public health challenges may not be able to access those services. In the case of Brazil, abortion is legal in the case of rape. So if this were Eve, she could potentially go and get an abortion on the basis of the fact that she was raped. Although, as we talked about, you have to actually go to the courts to do that, right? You have to go to the police, and you have to file a claim, and you have to go to court and say, I should be able to have an abortion because I was raped. And that's just not practically feasible for many, many women. And there aren't that many places that provide legal abortion. So in many states in Brazil, you can't get the procedure, right? So in that situation, abortion is permissible for reasons of rape, and it is also permissible for reasons of fetal abnormality, but not microcephaly. Anencephaly, which is a different condition, just basically the absence of a brain, is a cause for abortion in Brazil, a specific exception. So again, how do we link this to US policy? Well, some of you may have heard about the new proposed budget. And what we saw in the new proposed budget is a $54 million cut to US agencies. And many of these agencies are the public health agencies, Health and Human Services, CDC, National Institutes for Health. So about a 30% cut in the budgets of those countries. Well, why does this matter? What does this have to do with Brazil? Well, when Zika hit the Americas, right, we went on full alert. They have something at CDC called the Emergency Operations Center. And it's basically everybody on deck to help address this problem. So what happens when you cut a budget like this and you cut a third of the workforce? Well, it means a lot of people lose their jobs, for one thing, and it means that you lose a lot of resources. And so what happens is we have a reduced public health workforce. We have a reduced number of people that actually know about these diseases and know how to work in these kinds of situations. We have weakened public health infrastructure, right? And then we have limited human and financial capacity to expend when something like Zika happens, or when something like Hurricane Harvey happens, right? Similar kinds of situations where we need to kind of rally the troops, and we just can't do it because we don't have the infrastructure in place. So it also means less support for international development aid and an increased risk to global security. Well, let's take Eve somewhere else. Let's put her in Syria. We've heard about the Syrian conflict for many, many years now, and we hear about many migrants leaving Syria and making very dangerous treks in order to reach refuge in Greece and Turkey and other places. Well, what do they reach when they get there? They reach refugee camps or internally displaced camps if they're still within a particular country. But let's say that Eve was Syrian and she traveled and she managed to make it to Turkey. And then she gets to a refugee camp and she experiences a rape, right? That happens very frequently in refugee settings. Women may actually be in a camp setting or en route to a camp setting and experience sexual violence like this. Well, we know that as a part of the budget package, there are many cuts to the UN agencies, specifically UNFPA, which is the Family Planning Agency and organization, and that these cuts will actually have a really big impact on women's access to contraception and emergency contraception. And as I mentioned earlier, the global gag rule will make it so that no one can talk about abortion. There is one humanitarian organization in the world that operates in refugee camps, that receives zero funding from the US government, and performs abortions. One. I'll tell you who they are if you want to give some money to them.
Yeah, please tell us.
It's Médecins Sans Frontières, MSF. So they operate completely independently, and they provide those services. So here we can think about immigration. And really, I mean, this just proves how interconnected our world really is, right? So Eve, that woman that we felt so connected to earlier, she could be anywhere, right? And when we think about her and her circumstances and her condition, if she's an asylum seeker or a refugee that somehow manages to find her way to this country, she's somebody we would want to let in, right? I think so. I'd like to think so. But many people, like Eve, if she were in this situation, may not be able to enter the country. We're definitely going to see a reduction in the number of refugees and asylum seekers that are allowed in this country. And particularly from particular countries, the US State Department actually sets quotas for people coming from different countries. So this will definitely have an impact. But there's a bigger impact, actually, that affects us as Americans. And that is that about 25% of healthcare professionals in this country come from other countries, right? So a lot of healthcare professionals that are working in rural areas are actually foreign-born. And remember, Syria before the conflict was a relatively well-off place with a highly educated population. There are a lot of Syrian doctors. They're sitting in refugee camps right now, right? We can actually use them. So we really have to think about these things very, very carefully. So I said we could use them in this country. So let's take Eve to this country. My home state, Louisiana, where underage girls have to seek parental permission for abortion. there's a 24-hour waiting period and a requirement to view an ultrasound among 1,000 medically unnecessary requirements. 1,000 medically unnecessary requirements. And the reason I know, that's not an exaggeration, the reason I know that there are 1,000 medically unnecessary requirements is because the Center for Reproductive Rights has filed a case about this. And they've actually detailed the 1,000 medically unnecessary requirements that are in place in the state of Louisiana. That case is called June Medical Services versus Gee. It was filed last year, and if you are a Supreme Court watcher, take notice, because this is going to be the next big one after the Texas case. So you'll be hearing about this. In Louisiana, there were only 3 abortion providers in the entire state. And that number is down from 11 abortion providers in 2001. So you may be asking, what happened between 2001 and now? Why are so many of these abortion providers closing? And the reason why actually has to do with the Texas case, which somebody mentioned earlier. And what the Texas case was about what we call trap laws. And these are basically these kinds of medically unnecessary requirements. Things like abortion providers must have a hallway that is wide enough to fit 2 gurneys, right? Because in a hospital, you need to be able to push gurneys one way or the other. Except that these aren't hospital settings. 90% of abortions in the US take place in the first trimester. And most of those are with what we call the abortion pill, right? And so there's no gurney. There's no need for a gurney. So these are some of the kinds of requirements that we see. So I think about, I imagine if I was Eve, when I was 15 years old, in my community in rural Louisiana, where I grew up, and if I had faced these kinds of conditions, there's no way, right? There's no way that I would have been able to access services. And I think that these are real conditions for many girls and women in our own country. So we hear a lot about defunding Planned Parenthood. What does that really mean? So I want to share with you that abortion is prohibited through federal funds. Federal funds do not pay for abortion. They don't. Only 3% of Planned Parenthood services are abortion related. So everybody thinks Planned Parenthood, all they do is abortions, all day, every day, 24-hour open sign abortions here, right? Planned Parenthood does a lot of stuff. They do breast cancer screenings, mammograms, STD testing, provide contraception. So when we talk about shutting off funding for Planned Parenthood, we're talking about taking away sexual and reproductive health care services for women who want to go get, ovarian cancer tests or mammograms, right? So there are a lot of ripple effects here in terms of how we might impact women's health more broadly. And in fact, through the provision of contraception, Planned Parenthood actually prevents almost 300,000 abortions a year, right? The best way to prevent, if you don't agree with abortion, the best way to prevent it is to make sure that people have access to contraception, right? Unless you don't agree with contraception. But then, and okay, if you don't agree with contraception and you don't agree with abortion, then let's have a real conversation about, what should have happened in the case of Eve. If she experiences the violence, sexual violence that she experiences.
Punish the man who caused the pregnancy.
Yeah, and that didn't happen.
Yeah,
Right. It's difficult. So here we have to think about, again, the role of the legal sectors and the health sectors. And I'm kind of, we've talked through these things in terms of the different settings that we placed Eve into. And I've kind of noted here the different countries' participation in different international human rights norms. This one called CEDAW, which is the Convention on the Elimination of All Forms of Discrimination Against Women. And this is an important document because the US is actually a party to this. And it's the only international human rights treaty that includes a right to health that the US has ratified. So we don't, practically speaking, have a right to health. Legally speaking, we don't have a right to health in this country. But under international law, the U.S. has signed on to this. And it means that at the very least, we have said that we will not violate, we will not do things against the right to health. But we also have some work to do in terms of positive actions that we can take. So I've just mentioned here a couple of different laws that are relevant. This law 779, it's called Ley 779 in Spanish, which is an anti-violence law in Nicaragua, and a very poorly resourced health system. I already mentioned the total ban on abortion. In Brazil, I mentioned the restrictions on abortion, and there are 2 violence against women laws. This is actually what my current work is on, which is the Maria da Penha law and a femicide law, which are both violence laws in Brazil. And there is a functioning health system in Brazil. And then in Syria, we have to think about humanitarian law, right? A different kind of set of law, but also these US policies, which have a very important impact on these settings, like the global gag rule and like funding cuts to UN agencies. And then in the US, the Violence Against Women Act, we do have, and the Affordable Care Act, which there's a new bill, I'm sure you've all heard, that's up for a vote on Friday. So that's why I put the question mark. We have it until Friday, and we'll see what happens then. So these are just a couple of the things that we can think about in the context of these issues. So what's your role in this? Well, that's me in Washington at the Women's March.
And your hat.
And my hat. Yeah, I had little kitten ears on there and a little furry tuft. So politics in this country are very fraught. And I would say even globally, right? There have been a lot of changes in the political environment in the last year. And from my perspective, this signals a new era of human rights in this country and globally, I hope. And there are forces that are acting against human rights, and there are forces that are acting for human rights. And I'm not going to tell you which I think is which, but I will just say that I've been, really, really encouraged by the engagement of civil society in taking on these issues. And those movements have been characterized in a couple of different ways. One is that they are very intersectional. So what do I mean by that? When I went to the Women's March, there were people from Black Lives Matter. There were people from, that were worried about immigrant rights, women's immigrants' rights. There were people that are worried about reproductive rights. And all of those people were able to be in the same space together and say, your battle is my battle, and my battle is your battle, right? And so that's a really important kind of defining characteristic of the civic activism that I see taking place right now. They're also very decentralized in nature. There's no one organization in civil society that is saying, here's the agenda, here's the platform, this is how we do it, right? It's a lot more organic, a lot more grassroots. So the contraction of government, and this is something that is happening regardless of what's going on in civil society. We are seeing a contraction of government, right? These broad sweeping cuts to the federal budget, to kind of downsize the federal government. What does that mean? It means that a lot of issues are going to get pushed down to the state level, okay? So when we hear people talking about the Affordable Care Act and taking a more federalist approach, what that means is we want to let the states decide what they want to do, okay? And so that means Massachusetts is probably going to decide something vastly different than what Georgia decides, right? And then how do we talk about equality in this country if your access to a particular set of services is dependent on if you happen to, live in Vermont or Louisiana, right? So we have a federalist system, but I want you to pay attention because what you will see is that these issues are going to be coming down to the state level. So if you are a person, I have a feeling that no one in this room is like this, but if you are a person or know a person that only votes in presidential elections, you need to make sure that you are participating in every local and state election that's taking place because that's where these issues are going to be. decided. So what I encourage you to do is to pick an issue that you care about and then work on it at all those levels, local, state, and federal levels, and be an ally to people who share the values that you have, right? So it doesn't have to be your issue. I would say I'm not a climate change, I wasn't like I believe in climate change, but I wasn't like a strong environmentalist. I mean, I recycle, but I'm kind of like a low-level climate change person, or like I'm going to recycle my stuff, and I'll try to buy a hybrid vehicle the next time I buy a car or whatever. But I'll tell you what, when I was in my house, when Irma hit, and I had a big tree fall on my house, and I was very lucky that there was not more damage to my house and that everybody in my family was safe. I was sleeping in the basement with my son, and I heard the crack of the tree coming down. And I said, whoa, we need to do something about climate change. Yes, this is real. We've never had a tropical storm in Atlanta before. So, find those issues that you care about, but also be an ally to other issues that are related. And really, all of these, I hope what I've shown you by talking about Eve in different contexts is that all of this is related, right? So find your place in it and then do what you can. These are a few additional resources. I will make these slides available to you all so you can have the links in a couple of articles that I'll share here. I'm happy to take any questions you all may have. Yes?
Put Eve in a predominantly African-American community here in Georgia.
If you would repeat, so the webcast will pick up, thanks.
Sure. So the question was, put Eve in a predominantly African-American community in the U.S. or in Atlanta, right? I think she'd face a number of the same challenges. I think we can think about, how much trust is there between African-American communities and law enforcement if she were to experience a rape. It's pretty safe to say there's not a huge amount of trust between African-American communities and law enforcement. She might face, African-American women face terrible health outcomes, pregnancy outcomes relative to white women. The infant mortality rate and maternal mortality rate for African-American babies is double that of white babies. So that's the infant mortality. That is if she were to have the baby. Maternal mortality, there's actually a movement here in Atlanta. There's something called Black Mamas Matter. And maternal mortality in this country, the U.S., we're not good on maternal mortality. And why? Why? We have the best health services and system in the world. I mean, I don't mean to say we have the best health system and services, but we have the technology, right? We have the technology, we have the science. So why are women dying? So I think she would face a lot of the same challenges.
Where would she go? Planned Parenthood clinics are going to close?
Yeah.
Will Grady help?
Well, Grady doesn't provide abortion services, so she could probably get contraception at Grady, but that's not ideal. Grady is a hospital. We don't want people going to tertiary care for contraception. She could, but we want her to be able to go. She could go to a satellite clinic, one of the Ponce clinics, and get contraception that way. But yeah. Yes, Lee.
So I agree with you totally that we need to be active on the local and state level. But with this administration, don't you also think that the courts have a very big role to play, like with the travel ban way out in Washington, the Attorney General started it. So one, of course, I would encourage people to support the Center for Reproductive Rights, but just your comment of how, the courts is going to stop these things.
Yeah, I think, so I was in New York, roundabout way of answering your question. I was in New York in February, and it was the week after Valentine's Day, and I decided to give myself a Valentine's gift. And the Valentine's gift that I gave myself was to go see Hamilton. And if you haven't heard the Hamilton soundtrack, you must hear it. And what I felt seeing that show and listening to that soundtrack is how much I really believe in this country. And the reason that's an answer to your question is because I believe that we have a really good system of government that has checks and balances. And the courts have stepped up, right? They have responded. I don't think that Congress has been as effective in stepping up to the plate. And the only way that checks and balances work is if you actually check the other parts of power, right? So I think that we have a good system. I don't want to put too much on the courts because the courts, it takes a long time for things to wind their way through the courts. And so again, as I said, I think that there's a lot more that we should be doing on the front end. And from a practical perspective, that means funding, which is Congress. So I think that legislators in their states need to know if we defund Planned Parenthood, that means so and so many women aren't getting mammograms. So I'm not going to vote for that because that is a disservice to my constituents and my community. And we need to be holding those legislators accountable to us, right? If we believe that we want a certain set of services or a certain system, we need to hold them to account for that. Yes?
Can you name the countries that have complete bans on abortion?
I can't name them off the top of my head, but I will give you a website that you can go to. It's called worldabortionlaws.com, and it's actually a spin-off site of the Center for Reproductive Rights. So it's a global abortion map. If you just Google global abortion map, you will see it. And what it will do, it kind of codes countries in terms of red, yellow, and green. And it will tell you the specific limitations on abortion. I think there are about 7 countries that have a total ban. Yes? Which is the best country? If I was going to put Eve in any country, where would I put her? It would probably be one of the Nordic states. Norway or Sweden. I think she'd be in a better situation. Yeah. Yes.
So one issue of sexual violence against women is trying to prevent it.
Yes.
And so the issues then are, well, how can public health sort of work on that? And one would think that, education and working with an educated population and so forth. And yet, one of the big concerns across the country is sexual violence against women in universities and colleges.
Yes.
And so here you have presumably a population that is about as educated as one can have in an environment that overall would say that sexual violence against women is not what should happen, and yet it's happening. And so how can public health fix that?
If you could repeat some of that.
Okay, so the question is, we have a very highly, I'm going to try and drill it down, we have a very highly educated population here in the U.S., yet we still face sexual violence on college campuses. About 1 in 4 women between the ages of 18 and 21, when they come to college, right? The biggest chance of sexual violence in an American woman's life is her first 2 years of college.
Oh my goodness.
Right? Think about that as you're sending your granddaughters off to college. It's scary.
It's scary.
Exactly. 1 in 4. 1 in 4. Okay? And so we're no different. We're not any better than Nicaragua or Brazil or anywhere else, right? We have this issue at home too. There was a recent policy change by the Education Secretary, which was a rollback. And I can tell you that under the previous policy, every single faculty person at Emory was required to undergo Title IX training. Every single person had to do a series of education and take a test, right? Pass the test. You know how hard it was to get all those faculty to do that webinar and take that test? I mean, it was really hard, but they were, every single day sending us, you got to take this test, you got to take this test. And one of the things that I learned from that, it's so important, was about notification, kind of this mandatory notification that you talked about. So under that previous policy, the policy was that if a student revealed that they had experienced sexual violence even if it did not occur on the college campus or when they were in college, right, or when they were enrolled at the university, I was still required to report that. Because one of the biggest problems that we have is we don't have good numbers, right? We don't actually know. This violence, physical, the data that I shared in terms of the 1 in 3 number, the global prevalence of violence, is based on a study that's called the WHO multi-country study on violence against women. And it was a study that was conducted in about between 2002 and 2004 in several countries. And it was a population-based survey asking about violence. And this is the number that they came up with 1 in 3. But you can imagine that that's underreported, right? You go into somebody's house and you start asking them questions like this, some people aren't gonna want to tell you about a very stigmatized issue. So those numbers are probably an underestimate. So the question of mandatory reporting becomes really, really important because we think that 1 in 4 college-age women experiences sexual violence on campus. But actually what we really need to know, and I had this happen a couple of years ago, a student come to me and tell me that she was assaulted 3 years earlier on her undergraduate campus, and she never reported it there. So we can't, the first thing to answer the question is that everything in public health is evidence-driven. So we need to have the data, and we need to have really good data. And right now, we don't have good enough data. But then the next piece is that whatever we do has to be data-driven, right? Whatever the policies are and whatever the interventions are have to be data-driven. So I think we have a lot of work to do. And I think that it's going to take us a lot of time, and I think that, you know, the root of that really comes down to kind of gender norms and questions about what we expect of women and what we expect of men and boys and girls and how they treat one another. And that's a really tough challenge. We're working on it. Yes.
I want to get back to the idea of religion that was brought up earlier. If you look at different countries in terms of their predominant religion, let's say Muslim, Jewish, Hindu, Christian, does that play any role in here, or can you tease out anything from all of that? I'm just interested in your ideas. I realize it's a complicated issue.
Yeah. You know, it is very complicated. Oh, sorry. The question was, what is the role of religion in influencing these issues? So it's very, very nuanced. So I gave the example that in Nicaragua, in this study, religion was very important in the community in terms of community perceptions and even individual experiences. This particular community is a very Catholic community. And so I would say that it was religion in that case is something that would not encourage women to get an abortion. But I can give an example of the exact same religion, Catholicism, in the country of Cuba, where most of the population is also Catholic, but abortion is legal and is taken advantage of when needed, right? So religion in that case is not a barrier to this particular service. So I think a lot of it has to do with the way the medical service is framed, right? And what and particularly what the interactions are between religious and faith communities and the government. So in Nicaragua, the Catholic Church was largely responsible for passing the law on the total ban on abortion. Whereas in Cuba, religion does not play a role in the state at all. And so that influence isn't there. But I think that, you know, religious and faith-based organizations do enter into politics, and right, government policy is accountable to lots of different actors, and I think that religious institutions can play an important role in that, for good or for bad. Yes?
Is another variable whether or not what's happening to women is different in a city than in the countryside?
So the question is whether what is happening to women is different in the city versus in the countryside. So the WHO study that I mentioned, the multi-country study, when they did that study of violence against women, in each country that they looked at, and the data that I'm most familiar with are Brazil, which is a country that I work, And so what they did is they did, in each country, one sample in an urban setting and one sample in a rural setting. And we looked at these data pretty closely and have actually looked at a more recent version of the data from the Brazilian government. And the finding in that case was that violence was experienced by women in both settings. It tended to be more severe in, actually more severe in urban settings and more widespread in rural settings. So if you can kind of think of it from the perspective of in a rural setting, it might not be as stigmatized, right? In a more kind of cosmopolitan, metropolitan setting, people know that that's bad, right? In a rural setting, it's kind of like, do what you will. But in an urban setting, it's a little bit more stigmatized and so more hidden, more private, right? So they actually found that violence against women in rural areas more often happen in public spaces, and violence against women in urban settings happen more often in private spaces, and that violence was more severe. So you might be in your own home and experience very extreme violence, as opposed to publicly being slapped, you know, but in your home being beaten, right? That kind of thing. So there is some variability, but I think it varies from country to country and setting to setting. Yes?
Yeah, so you indicated earlier that the first 2 years of a young woman in college has the highest percentage of being sexually abused. I'm just kind of curious about what it's like with the men. Are they in that age range? Is it testosterone related, or does it part over a much larger?
Beer and testosterone.
Yeah.
I think that's it. The question is whether there's a spike in testosterone in men in that age group. I mean, certainly, you know, that there are definitely hormones involved, but I think that probably, yes, alcohol probably has more to do with it. You know, the kind of fraternity and sorority culture of, you know, keggers at frat houses, that kind of thing. And I'm sure we all have, you know, I had my sorority days too, and we have fond memories of those times, not necessarily the keggers, but that it's a context that allows for these kinds of things to happen. So I think it has more to do with context than hormones. Yes?
Yeah, it just seems in that setting also, lack of parental control is another, and peer pressure and environment are really strong in setting standards for college behavior.
Absolutely. So the question is, you know, about a lack of, or comment, I would say more lack of parental control. Of course, young adults are living independently for the first times in their lives. They're asserting their autonomy, and at the same time, you know, particularly among young men, you know, the question of what is it to be a man for the first time in your life, living independently on your own? What does it mean to be a man? And I think that unfortunately a lot of times that can, and especially in situations with peer pressure, you know, that has to do with aggression, aggressive acts, hypersexual behavior, and so it's kind of a recipe for disaster.
There's a lot of this in
Oh, yes, that's right. Well, perhaps we should wrap it up. I'm sure Dabney will be willing to talk to people up front here. I think we can all see how deserving she is of the American Public Health Association Award for Achievement in